We are recording this session since we would like to be able to share it and the other sessions that we run in this field. So if there's a problem, do let me know by chat. Otherwise, we'll continue recording. Thank you. Good to see some names and faces that I recognize. Hi, Sandra. Good to see you. So we're gathering in people as they come, and Christy is expecting one more speaker to join her, along with the panel of speakers that we already have. But I'm going to introduce Christy very briefly in a second, just to say that you're very welcome to this Catalyst 2030 Mental Health Collaboration meeting. The Catalyst is, as many of you know already, is an organization of social entrepreneurs, and we divide our work up into chapters, country chapters, regional chapters, and also into collaborations. These are the subject areas of the organization. And so,
don't join them.
So we are the mental health. This particular webinar is the beginning of 3 webinars that we're going to hold. And we are really grateful to Christy Siveta for being our editor.
Matt, you don't join? Huh?
Hi, Nancy. That's right. If you could put yourself on mute, that would be great. And so we're very grateful to you, Christy, for running sessions, which is incredible. The reason why it's so important is that our membership, which now members over 130 organizations in the mental health collaboration, have all stressed to me over different times and periods how important fundraising is to their well-being as mental health organizations. And so it's felt sensible in discussing with Christy to really be able to bring this subject to bear over the next few months.
Yes or no? We'll do it for a few minutes. And then...
Christy has over a decade of experience working in organizational strategy and partnerships in global development, health and technology. Her work has cut across numerous sectors, including a deep background in mental health, working both as a counselor, building digital tools for therapeutic interventions, and consulting on privacy and data security implications. She currently operates as a consultant, supporting socially minded organizations like Dimaji to build upon their programmatic strategy, secure funding, and expand their impact. She is the owner and operator of Be Lumen, her own organization. Christy, many, many thanks for working with our collaboration and for undertaking this important and somewhat Herculean task of working with us over the next 3 webinars, including today. Over to you.
Thanks very much, Chris, and a real pleasure to be here. And thanks everybody for joining us today. So as Chris mentioned, I'm the founder and the director of Be Lumen. We're a consultancy that supports socially minded nonprofit and for-profit organizations with company and commercial strategy. We are big fundraisers, very big in the mental health space, and to date have helped our clients close over $80 million. So we are taking our experience and those of the experts in the field who are on our panel today, and turning it into a 3-part webinar, as Chris mentioned. So as I said, this is the first of 3. Today, we're going to focus on the overview of current mental health fundraising and the general landscape. So we'll talk about trends, topics, things funders are interested in, and get some perspectives from some very cool people on our panel today. The next 2 are going to be a little more granular. We're going to dig into costs and impact in the next webinar and how to talk about that. And in the final one, we'll talk a little bit more about how to develop and deploy a fundraising strategy. We'll dig into things like win themes and talk through kind of both sides of the story when it comes to both funders and fundraisers. So please feel free at any point across our panel today to ask questions. You can throw them into the chat. And we have some folks on the call that will help moderate those, and we can address a few of them at the end. So as I'm sure most of you guys know, there's a huge need in mental health. 250 million adults in this world experience depression. Only 25% will ever receive the care that they need. We know that the funding pot for mental health is small, making up less than percent in some areas for government health spending, and only 2 to 4% of global development funding on a good day. However, there is a growing dedicated group of funders and advocates, and we are very pleased to be joined by a few of those folks today. So without further ado, I'm going to introduce our panel and we can get started. I will introduce all four of our panel members. I don't currently see Margaret on this call, Chris. Let me know if I'm missing her, but I'll introduce her as well. So when she's able to join us, she can just jump right in. We'll start first with Victoria Taylor. Victoria is the program director at CRI Foundation, a Boston-based family foundation focused on cost-effective, impactful health programming in Africa. She also serves as the executive director of the Risk Pool Fund, an innovative collaborative funding approach that provides fast, flexible funding to protect impact during unexpected events. Welcome, Victoria. We're happy to have you. We also have Sahil Chopra here, who is the portfolio manager of global health innovation at Grand Challenges Canada, where he played a key role in launching the Being Initiative, which I'm sure some of you folks have heard about, which is putting millions of dollars behind preventative and holistic well-being for young people. Previously, he contributed to India's 2016 deworming program, reaching over 160 million adolescents in a single day. We're super excited to have you join us. Thank you so much. We have Anna on the call as well. Anna Kidd is the director of the SHM Foundation, overseeing its global initiatives with a specific interest in using digital networks for social change. She also co-founded Zumbido, a mobile health project in Mexico, and has extensive experience in mobile health across Latin America and Africa. Before joining SHM, Anna worked on research projects for organizations like UNESCO and the Fair Trade Labeling Organization. Thank you for joining us, Anna. And finally, we have Margaret Laws, who is the president and CEO of Hope Lab, a social innovation lab and impact investor dedicated to supporting the mental well-being of adolescents, particularly BIPOC and LGBTQ+ youth. Margaret previously spent 17 years at the California Healthcare Foundation, where she founded CHCF Health Innovation Fund. And we are super delighted for Margaret to join us. I'm still not seeing her on my screen, but Susan, Chris, let me know if I'm missing something. If not, we'll just get started.
Currently, she's not with you, Christy, but we'll start to
cool.
Look around in the background.
Okay, that sounds good. We'll just get started then. Okay, panelists, thank you so much for joining us today. We're going to kickstart with our first question. We'll start with a bit of a broad spectrum here. So given the increase in global awareness in mental health, which I know most of us are seeing and experiencing, either as implementers or as funders, what trends have you seen within mental health funding or financing over the past few years? Are there any particular shifts or emerging areas that funders are prioritizing that you think might be useful to highlight? I'm going to start, Sahil, with you, if you don't mind. I know with Grand Challenges Canada and the Being Initiative, you guys did a massive overview of mental health needs. So it'd be great if you could share a bit about that experience and anything else you'd like to share for this question. Over to you.
Sure. Thank you, Christy. And I'm very excited to be a part of this work. So as a Grand Challenges Canada, in recent years, we have seen notable shifts in mental health funding. And this reflects also a growing global awareness to address mental health challenges. GCC has been at the forefront of these changes since 2012. We have till now invested in over 150 innovations with a total commitment of approximately $65 million. A key trend that we have observed in recent years is an increased emphasis on localization and a meaningful engagement of young people and individuals with lived experience. This shift is evident in our recent initiatives, such as the Being Initiative, which was launched in 2022. This initiative is designed to focus on mental illness prevention and the promotion of mental health through bottom-up scalable solution. And our approach reflects the evolving trends. For instance, our initial year from 2022 to 2023 within this initiative was dedicated to a comprehensive landscape analysis in our 13 priority countries. The actual idea was to understand the local mental health needs, what are the system gaps and capacities to ensure we select our funding priorities based on those needs and based on those gaps. While traditional desk research. We did a traditional desk research, which played an important role, but we prioritized engaging with diverse local stakeholders, which includes government officials, mental health professionals, educators, social workers, researchers, so on and so forth, and most importantly, young people and individuals with lived experiences. I think this multi-sectoral approach ensured a well-rounded perspective on the complex challenges of scaling mental health interventions with a key focus on drivers that negatively impact mental health of young people. And then we followed a consensus-driven process, which was used to identify the priority areas and ensuring that interventions that we fund are both relevant and effective as per the local needs. And the second thing that we did was the youth-centered strategies. So the Being Initiative, we underscore our belief that those closest to the challenge are best positioned to address the needs. Young people have been integral to our process, from advising and facilitating consultations to validating findings. They served as program advisors, members of the Scientific Advisory Board, and they have been actively involved in designing, implementing innovative solutions. And lastly, I think we launched a funding call, and we are very excited about it. We launched a funding call this April. And we have made a choice that we will prioritize youth-led organizations over other organizations. And now within our round one, we are in the process of selecting 20 innovators so far. And we are very proud to share that 98% of our funding would now go to locally led organizations, out of which 85% organizations are youth-led organizations. But most importantly, 100% of our projects are youth-led projects. So I think this is the trend that we have seen recently, and I'm sure I think this kind of a trend is becoming increasingly prevalent among other mental health funders too. Thank you, Steve. Over to you.
Thanks so much for that overview. And it sounds like, and we're seeing it a lot in the space. I mean, youth-driven initiatives and focusing a lot on youth mental health is a really massive trend at the moment, especially when it comes to historically marginalized youth groups as well, at that intersection potentially between mental health and other issues, potentially HIV/AIDS, for instance, SRHH, things like that. Anna, over to you. Would love to see, in terms of your perspective, anything to add here, any other trends you want to share that's happening in mental health funding or financing?
Yeah, we founded an initiative called Ember Mental Health, that supports grassroots mental health initiatives across the globe. And we did that now 5 years ago. And I think we can really see a change. There are, as what Sahil was just saying, I think definitely a lot more funders coming into this space, a lot more interest in an understanding that mental health needs to be a priority, a funding priority. Having said that, there's also so much, we're seeing so many more mental health initiatives coming to our plate and wanting funding. So it's, there's a lot going on. I think, but there's still a huge amount to do to try and convince more funders to come and work in this space. I think there's still perhaps a bit of a fear around how do you fund in this space. I think, it's an area where it's seen to be, although I don't believe that, but seen to be as a risky area to be funding. And so we have had to do quite a lot to kind of help others think about how do we navigate that and how do we make it feel, or, de-risk it. I think it's something where also funding for the long term is really important. And that sometimes, again, is an area that I think gets some funders a bit worried and concerned about how are they going to do that. Measuring impact, again, is also another area that I think people get worried about and not quite sure what does success look like. So again, I think there's a lot to do to sort of, I guess what I'm trying to say is there isn't like all these grants out there that you can apply to. It's sort of bringing people along and finding ways to bring them along. And yeah, but I'll leave it at that for now.
I think that's a great perspective. And also, thinking about it is a small pot of funding, but it's becoming more competitive, if you will. There's so many wonderful initiatives out there, and it makes it more and more difficult, especially with the funding pot quite small. And so I think you're right, bringing folks along with that conversation and bringing fellow funders along, or having those conversations with funders and opening up their eyes to, hey, mental health is a big need and we can de-risk it, and there are these tools and there are these high impact interventions. You know, how do we really generate more noise in this space? It's a really great point. Victoria, over to you from your perspective. Anything else you'd like to add in terms of trends?
I would agree wholeheartedly with everything that my colleagues have said. I think there is certainly in the philanthropic space, which is where I mostly dwell, there is a recognition of the need. I've seen a lot more interest in funding youth mental health post-COVID. I think that's far more on the agenda when I attend, you know, groupings of philanthropic funders. But I think the point that Anna made is probably the biggest one that I hear about, which is this idea of what is my return on investment if I fund mental health. I mean, that is probably the biggest question that certainly in the space I move in, that philanthropic funders are thinking about, and even trying to understand what does impact look like in this space. When you're trying to convert your thinking, when you've been, say, for example, a maternal health funder, which I was for many years, how do I convert my thinking of, you know, how many safe deliveries, how much family planning has been provided, how many, you know, infants have received vaccinations? How do I convert that way of thinking about my impact into the mental health space? And I think this is something that funders across the board are really struggling with, is understanding, you know, what their money buys, if you like.
I think, I mean, fantastic points, especially on the measurement pieces. And I think it's well recognized by many folks, both funders and fundies, implementers alike, that actually having the lack of standardized tools, for instance, across different projects and different mental health interventions is difficult. It makes it very difficult for funders to understand what is the risk of this investment I'm getting myself into here. And actually, because we're on the topic, I'm actually going to jump us panelists to a question further down our list today, just because it came up naturally here. And we're going to talk a little bit about measuring and thinking about impact, if that works for you guys. So kind of building off what you guys were talking about. And for folks who are listening in, this is going to lead in a little bit to the conversation we'll have in October on cost and impacts, and how from a implementer perspective, when you're talking to funders and applying for funds, how you can do things like talk around, you know, the costs associated with impacts and measurement and tools and things like that. So we'll start here with the funder side. So as a funder, you know, broadly to all of you guys, how do you think about the impact of your philanthropic investments into mental health? And Victoria, I know you just alluded to it a little bit there, but you know, what kind of metrics or outcomes do you think about, or do you see many of your grantees using to demonstrate the effectiveness of the programs you guys are supporting? So Victoria, if you don't mind, I'm just going to start with you again, and we'll jump over to the rest. Go ahead.
This is such a hot topic. I actually have members of my team at the moment doing sort of deep dive literature reviews and research into this. And I'm fortunate enough, very unusually for a small foundation, to actually have 2 PhD economists on staff. And so when you set them a task, they go at it. I think what is really tricky is we're used to being able to apply some sort of metric or some sort of indicator of change to the work we do. So we like to say that our investment, our grant, however you want to frame it, has resulted in fewer deaths, or you know, less morbidity, less mortality. These are the things we're used to dealing with. So when we go from being those kinds of funders to the sorts of funders who are funding in the mental health space, we want to be able to count how many people are no longer ill, no longer at risk. And it's really hard. And so we've tended historically to look for things like the PHQ-9, you know, the patient health questionnaire. And we look at it and we go, okay, so if we do the PHQ-9 before they undertake the intervention, and we do it after they undertake the intervention, then we see a change. And there are organizations out there that will tell us that they see a 40% improvement in. But then when you start to get into the weeds of these things, as anyone in the space, or if you have lived experience of mental health, you're like, well, is that really a good measure? And then so the PhD economists that work with me say things like, how applicable is the PHQ-9 as a measure of depression in a low and middle income country? And I go, I don't know. And then they go and look for the research. So these are the types of conversations we're having. I think what is really tricky, and the folks in the room here are probably the source of the best information, is that I don't know what I should consider a reasonable impact, magnitude for mental health to be. Is it the PHQ-9? Is it something else? I don't know. And so and I'm not alone in that. A lot of funders are, I hope, I'm having this conversation with a lot of funders, but I hope beyond the philanthropic space, this is happening within, multilateral and bilateral funders as well. But I need help from folks like you to tell me how I understand this, because as somebody who's spent my entire career funding in the sexual reproductive health, maternal health space, I know how to count CYPs, couple years of protection that we get from family planning. I know how to count maternal mortality. I don't know how to count this, and that makes it really hard for me to communicate with my board. And so Anna articulated that funders find this a risky space. And for me and the folk I deal with, the risk isn't so much that the money won't do good or that the money will be misused or something. It's that we won't be able to measure what the money's done. And that is a real barrier. And I haven't given you any answers. I've mainly given you questions. But I'm being honest.
I think it's fair.
Yeah.
Yeah. No, I think it's totally fair, and a massive trend, right? As you were saying, and as we're seeing in the conversations. And also, before I hand it over, Sahil, and I'd love to get your perspective from Grand Challenges Canada. Before I hand it over to you, I mean, we also know that this is something that implementers are dealing with as well, right? If you take the Coalition for Scaling Mental Health, for instance, which is a coalition recently started by Friendship Bench and Strong Minds, Ubuntu Center for Peace, and the Shamir Institute, they're outlining big pieces and big things that they want to be building as a group of implementers, not just them, but everyone who signed up for that coalition, to think about what are there universally applicable metrics and or things that can be culturally contextualized in order to understand a genuine change in someone's mental health and well-being that is potentially different from thinking about stuff in clinical terminology, which is often generated from more Western sources, right? So how do we think about those things? And so it's definitely something that I think both funders and implementers are thinking about and juggling with. So Sahil, I'm gonna open it up to you. I think the Being Initiative takes a really interesting approach when it thinks about tools and measurements. So over to you to share a bit more about that.
Absolutely. Thanks, Christy. First of all, I think I'm completely aligned with Victoria. I think there's a huge challenge and there's a lot of complexities around like how do we measure mental health outcomes. So if you look at like very broad, then Grand Challenges Canada looks after only two outcomes primarily. One is the lives improved and the other indicator is life saved. These are our two primary indicators. But for mental health, we said like we would not focus on lives saved. We would only focus on lives improved. So that's the one indicator at the very broad level that we we decided. But in terms of the outcomes, in terms of the tools, we have given the complexities just Victoria mentioned that we have now realized it is not wise for a funder to advise innovators about the specific tools and outcomes. So we have been very liberal and we have been very open in terms of asking our innovators to choose the best tool that they fit is relevant for in their context. For instance, we have funded like diverse portfolio. We have funded one innovation which is around deaf-blind individuals, deaf-blind young people, and we know that we have existing tools. Those tools won't fit to measure the outcomes that we want for that particular vulnerable group. And then we have exciting organizations like Green Strings Network. I think they have been measuring like an important thing. But having said that, I think we are very liberal in terms of asking them what kind of outcomes that you think would be relevant to measure, and we would discuss with you, and then we would move forward with understanding how do we measure impact. And second, we would rely on you to tell us about the kind of tool that you've seen fit. And it is also about not using an exact tool. It is also about adaptation. It is also about like, how do we modify our tools to fit best in terms of those things. I think this is the kind of approach that we have recently took under Being Initiative. So I'm not sure how well it will go, but I think we have decided not to be prescriptive. I think it is more about the collaborative approach, working with like young organizations. And also, since our focus is on youth-led organizations, we also realized in terms of the capacities. So we have also had our learning and support provider, Origin, who is providing a support to these innovators on monitoring and evaluation. So I think this is an important also area to understand, like most of the innovators who are new in the space of mental health, they may not know about the outcomes. They may not about the tools that they could implement. So how do we build the capacities of these organizations? So I think I would stop here, but this is the very liberal and open approach that we took so far within the Being Initiative. Thanks, Chris.
That's wonderful, and it's really, we'd love to hear from you after you have a few rounds of the Being Initiative to see how it's gone, because it'd be great to hear a bit more about some of the metrics that have been proposed, and what kind of learnings we could take from that. Anna, over to you. In terms of, and especially this capacity building idea, because I know with Ember, you guys really focus on being a partner with implementers, right? And so I'd be curious from your perspective, how you guys thought about the impact of your investments into these organizations and with SHM, but also with the Ember initiative as well.
Yeah, sure. So yeah, in some ways, very similar approach to the Being Initiative. I have an impact team that work with me, and every initiative that we work with, we think about what does impact, what kind of tools, what kind of things do they want to use to measure their impact. So it's really comes from them and what they're looking for. So for example, sometimes it is doing the PHQ-9 questionnaire, because that's actually where they want to get to, because they actually want to get a journal article out about their approach and their methodology. In some cases, it's a photo voice exhibition, for instance, one that we work with in Ecuador called Huerta Manías, which is for a gardening collective for people living with schizophrenia. They wanted to do something that showed the kind of journey that they've been on through photography, and that was what was important to them. So we work with each of them very carefully to think about that, because what we don't want to do is to impose some kind of methodology or tool that is not going to work for them, given how little resources they have. But I think also, just reflecting on what you were saying, I think there's a big need as well to continue with the diversity of tools and approaches. I think that I get concerned that often then some things get, there are some initiatives that may get funded more because they've had the kind of evidence-based, inverted commas, done, whereas others who, maybe give you an example. There's an initiative that we work with called Paula. They're based in South Africa. They do narrative therapy. And she had developed a fantastic methodology called Courage, which helps young women with anxiety and depression in townships in South Africa. And we partnered with academic Rochelle Burgess at UCL to help us evaluate that initiative. And it was, what we found was that there was a significant decrease in anxiety and depression. But to actually make that work was like a little bit of a miracle. We cobbled together a bit of money to make it work. We got Rochelle excited about it. And it was an art therapy technique, which I don't think would have got research funding for someone to then go and evaluate it. So I think there's a big need for us to, more funding to go into this space, to think more creatively about what we mean by impact, and to be comfortable with that, and to be comfortable with not thinking that we've got one or two instruments that are going to tell us the answers to, the mental health crisis, because as we know, it's so complex and so diverse. So I think we really need to embrace that diversity.
I think that's a beautiful way to sum it up, Anna. Absolutely. And it's, really a call for both implementers to share what works best in their worlds, and also funders to make sure that they can open up their doors and their eyes a little bit to being creative when we think about impact and what it means to have a return on the investment, for instance, that you're putting into a group. So I think that's a really wonderful way to sum it up. Thank you all for your contributions on that. Shifting to a slightly different question, but potentially leading on, depending on your response. Where do you folks see the most significant gaps at the moment in mental health funding, right? We've talked about research, talked about youth, we've talked about other areas where funding is existing. Where are some of the most significant gaps in mental health funding, especially when it comes to lower and middle income communities? Sahil, I'm going to kick it off with you, if you wouldn't mind, and then we'll pass it along.
Sure. Sure, Christy. I think for Grand Challenges Canada, since we also partner with scaling partners, like we fund innovations till the time they are ready for scale and sustainability. So we want to look for organizations who could scale those innovations across the country or across the province. And our major scaling partner has been a government. So government is the one who is actually taking these innovations and making sure that it is reaching across like more young people. So I would say like we have observed two major areas where funding gaps are now most pronounced basis on our experience from the landscape analysis. One is of course the government funding for prevention and promotion. And I think Christy, you've already mentioned that. I think again, just to reiterate certain data sets, mental health remains like critically underfunded compared to other areas of health. As we all are aware, only 2% of common health budgets that have been allocated to mental health, and this figure is actually dropping to less than 1% when we talk about low-income countries. And this is not, but the major worry is that the 80% of this funding is directed towards institutional care, which leaves significant gaps in community-based and preventive mental health services. And I think this gap is concerning because given the growing evidence of the cost effectiveness of early interventions, the community-based approaches, and I think they are all essential for reducing the overall burden of mental health issues and improving long-term outcomes. So this is a kind of a significant gap that we observed in our landscape analysis. And the second one is the private sector engagement. And I think this area is still, they haven't played a significant role yet in mental health funding because when we did this analysis, the major challenge that all the organizations felt was to mobilize private sector together to make them convinced that mental health is such an important that they should invest in. So unlike other sectors where private investment has been transformative, mental health has not seen similar levels of private sector engagement. I think this lack of involvement may hamper the development of what we observed is now they may hinder like innovative solutions and scaling of effective interventions. So that's my point. I think these are the two areas that we observed so far.
Thank you so much. I think that's a fantastic point about institutionalization and how difficult that's been as well for a lot of governments potentially, aiming to shift away from that a lot. There's a big shift towards community-based and community health initiatives in terms of mental health as well. And as well, that note around private sector funding. There's been, if you look at some of the apps like Headspace and a few of those, there's been billion-dollar investments into like well-being applications specifically tooled for like higher income communities, for instance. But the translation of those for similar issues into areas, especially in low middle income communities, we're not seeing that same investment. You're absolutely right. So figuring out how do we, talking about growing this mental health pot, how do we bring private funders and, the private sector on this journey with existing global development funders, I think is a fantastic question, and figuring out how to generate that. There's an interesting coalition currently being put together, I think, with a few, like Kokoro, I think, for instance, McKinsey Health Institute, a few others, and I'm not going to name them all, but it's the Coalition for Investing into Mental Health, I believe it's called. And I think there's an official kickstart in October. So it'll be curious to see how that potentially contributes to this, especially as well bringing into the private sector. If any of the panelists know more about that, feel free to drop it into the chat. Victoria, shooting this question over to you. In your experience, where are some of these significant gaps you're seeing?
So I think, and Anna could probably speak more to this because of the types of organizations she works with, but I feel that there is this shift to community-based interventions, which are often provided by smaller grassroots, locally led local organizations. but I'm hearing from those partners that they are restricted by single year grants or 2-year grants. And so essentially you're making these almost one-time investments into these organizations. They're getting some momentum. They're actually getting some traction in the community, and then the funding ends, and then they're having to contract because they don't, they can't keep the staff, and so for me, the need for multi-year funding is what's needed across the whole localization agenda. If we're honest, if we want to support localization, then we need to have multi-year commitments. In addition to that, and I feel really strongly about this personally, but we try really hard at CRI to do this, is I'm hearing from so many organizations that it's easier to get project funding. It's really hard to get more unrestricted funding that you can use to invest in your organization. And again, if we're shifting the interventions to community-based interventions and we're expecting community organizations to undertake them, then we need to invest in those organizations so that they themselves have the infrastructure, have the personnel. And so those are the areas where I'm seeing the gaps. The other thing, and I don't know enough about this, and I'd be really interested from the community to understand more, but I am yet to have anyone ask me for any money for prevention. The only applications I have ever had, the only interactions I've ever had with mental health organizations working in different places has been about addressing the need. And so I am just personally fascinated by, you guys must be doing stuff in the prevention space, but it doesn't seem to be coming to me. And is that because other funders are pushing back, or is that because it's harder to present? I don't know the answer to it, but to me, those are probably the biggest gaps I see.
That's really interesting, especially the prevention piece and not receiving a lot of funding applications for that. It's really interesting to hear and see. And I'd be curious about the relationship between that and folks' feeling of measurability and kind of evidence back for that. And that's I'm curious. Yeah.
Accuracy, and you look at a foundation like CRI that is so impact focused and so evidence focused, and I think it's harder. And so what we need to do to create the evidence and the impact and the messaging and the story about prevention, because we're able to do it with other things. We can do it with vaccinations, we can do it with deworming, all those sorts of things. So
right.
Is it here?
Right, absolutely. And I know, there are some funding applications open that are kind of focusing on those upstream effects, right? And we've named a few of them today, and we'll put up a slide at the end. But I'll be curious to see kind of what kind of applications come through that and what the analysis is, if you will, about how much are truly in the prevention space. Anna, I'm going to throw it over to you before we close out. Anything else you want to add in terms of some of the areas of significant gaps in mental health funding?
Yeah, I mean, I think my fellow colleagues have said a lot that I think is correct. I mean, what I think, but I still do think that there is definitely more people funding, locally based initiatives, but I still feel that it seemed to be the kind of nice to have. It's a nice extra. It's never really quite seen as like the solution. And this comes very much from, our personal view at Ember is we really, really strongly believe that there's a huge amount of innovation happening at community-based level, and it has historically not been funded. It's been neglected, and there's a lot that we can learn from that. But we really need to give flexible funds, trust, really give trust, to people in these community-based organizations, understand that things are not linear, things happen, I think that's where we would really love to see others come on board and take, I guess, a similar approach to us, because we see it as being very rewarding and seeing some amazing things coming out of it. So yeah, I think that's probably what I've got to say.
No, that's great. I agree. And that drive towards kind of flexible, trust-based philanthropy, I'm hoping that's a big part of the future of mental health. And it sounds like from what everyone's discussed today, I mean, hopefully that's on the cards. And so in terms of kind of closing us out today, the last question I'll ask you all, looking ahead, what do you see as the future of mental health funding? Are there any innovative funding models or collaborative approaches that you believe could significantly enhance support for mental health globally? Feel free to respond to that and or give any closing remarks. Anna, do you mind kicking us off?
I mean, I really think we've all got to work together as funders and as partners if we're going to do anything, really make a seismic shift in this space. And I think there's a lot going on Kokoro are doing a fantastic job in creating a network of funders. And so we are definitely talking a lot more than we were before. So yeah, I think we need to be understanding what the ecosystem needs and really thinking about how collectively we can work together on that. So we're really keen to share our insights on what we're hearing from the work that we do. And, you can access them if you want to on our website and things like that about, our approach to funding, our approach to how to measure impacts, so that hopefully we're helping others think about how to work in this space and bring them along. Yeah.
That's great, Anna. Thank you so much. Victoria, over to you. Any final thoughts here?
Yeah, I just really agree with Anna. I think everybody should do exactly what Anna does. I think the world would be better if we all funded the way that Anna's able to fund. I mean, I say that lightheartedly, but I do mean that. I think there is something really important that needs to shift to allow for flexible funding, multi-year funding, and funding that is responsive to what the doers are telling us they need, rather than what people sitting in my chair think they need. And so, but a big part of that is about bringing it all together and coordinating better, because sometimes I do things that are not the right thing, not because I'm evil, but because I don't know. And so the need for collaboration and the need for coordination in this space, particularly as it is exploding at the moment, is just so important. So yeah, to reiterate that, and yeah, that's my 2 cents.
Thank you, Victoria. Appreciate that. Sahil, over to you for any closing thoughts.
Oh, thanks, Christian. I agree. I think I like the point what Anna mentioned about having a lot of innovations in the community. I think what we've realized as a Grand Challenges Canada, since we funded like 1,500 innovations so far, that there is a there's a push, there's a lot of supply of innovations or interventions, but there is a lack of demand of uptaking those innovations. And I think there's a need to build ecosystems, and that's why I think Being Initiative is not only about implementation. We have been also about ecosystem strengthening piece is an important element, which talks about advocacy, which talks about how do we build systems innovations, how do we strengthen, how do we build catalytic environment for these interventions to sustain and scale. And that's why organizations like United for Global Mental Health, these are the organizations who can really push, who can really create that kind of an environment wherein those interventions can also thrive. So this is what we believe in. Also, like ecosystem strengthening should go also in parallel with implementation. I'll pause it.
I think that's really powerful. And you can definitely see that, of course, obviously with the Being Initiative and having that ecosystem strengthening alongside it. Panelists, thank you so much for answering our pre-described questions. We have a few in the chat, and so we'll spend the next few minutes just focusing on that, and then we'll do a bit of a sum up. So I'd like to just kick off with one in particular, which I think is super interesting. It's how to think about innovative finance and blended models and how we could potentially scale investment and impact in mental health using those types of approaches. There's a big question on how to implement that. And I think that's a meaty one for the next few minutes, but I'd be curious your thoughts on, thinking about innovative finance and blended models and any kind of experience or thoughts you might have on that. I won't call on you all. Feel free to jump in with your response on that.
I mean, I'll be brave and say really not my wheelhouse. And I think the fact that none of us have sort of jumped in and said, oh yeah, that's a great idea, this is what we've done, or this is what we think about. I mean, maybe the other two are about to, probably is the answer that you're looking for, which is this is happening in other spaces, for example, in the wash space a lot. And I'm not sure in the health space, which is where I live, we've necessarily thought this through or had much experience with it. The closest I have is the risk pool fund, and we give loans in the risk pool fund. But I mean, that's not the sort of thing you're describing. So I mean, I'd be interested in Anna and Sahil's view, but my view is honestly, hand on heart, I haven't even been down that road. So I don't know.
I think that's an awesomely honest response. I appreciate that, Victoria. Thank you. The one thing that did pop into my mind while you're talking was the Inner Foundation does some interesting impact investment in mental health, and that could be an interesting place to explore. They're an organization, I think they funded both for-profit and nonprofit organizations, but they do have an interesting investment model there. But I do agree. I think the blended finance model is not one we often see in the mental health space. And more often than not, when I've seen it or come across it, it's been very digital focused, very innovative focused. Folks are looking at kind of return on investment for a potentially also commercially scalable product. And so it really is, we could use more of that blended model with less of that commercial focus sometimes in our space to really drive more catalytic interventions, I think, when it comes to mental health. I'm going to jump to another question, unless Anna, Sahil, or Chris, if you guys have anything to add on this topic.
Thank you very much. No, I'm just wanted to let you know on a process basis, I sent you an email, which I think you must have got with some of the questions. And we have another question in the chat from Addy as well. I noticed that, yeah, Addy Polonia. So what I think we've got is a very vibrant set of questions coming in from, and comments coming in from different members of the participants.
Awesome.
Yeah, and that's good.
That's great.
I've really enjoyed hearing the speakers today. I think it's really helpful to have the perception of speakers, and it's extremely for those of us who are making applications from time to time.
Yeah, I couldn't agree more. One of those questions I think is interesting. We touched on it lightly, so I'll just bring it back up with us to dig into now. Is, there's a massive spectrum, of course, of mental health need, and one of the questions, let me just pull up to make sure I got the wording exactly right, on that change journey for mental health. Where are we seeing some of the trends in terms of where funders are willing to invest? So awareness and stigma reduction, anti-stigma work, knowledge, diagnosis, treatment, maintenance, on that kind of spectrum of work. And I know we briefly touched on it today, but be curious if you folks could kind of share a little bit more about where we're seeing some of those trends. Sahil, I'm going to actually call on you to start, because I know that you guys have quite a lot of work with Being. Go ahead.
Sure. It to answer this question, I think it depends upon what the focus is. If the focus is on prevention and promotion, then we could see a lot of interventions around awareness. And I think the 20 innovation that I mentioned, I think we have seen a lot of innovations around digital. There have been a lot of digital solutions, but again, the problem is we don't have scalable digital solutions. We do have a lot of digital mental health interventions. I think the digital space is still booming, a lot of interventions, but we need to understand it is not only about developing, it is also about sustaining. Awareness, we saw, the one thing that I think I would emphasize is the stigma programs. So what we have learned, it is not only important to just focus only on specific on anti-stigma interventions. I think what we have done so far is anti-stigma intervention is now part of all our interventions. So you build on anti-stigma things and then you build on other things. So this is what we have learned so far. Stigma should not be left alone. I think it's an important integral component of all our interventions. And then the awareness, and yes, I think the other we have seen now is ensuring the involvement of young people. How do we build capacities of young people? How we can make those young people as a game changer. I think those kind of models that we have also seen so far in our proof of concept models.
That's great, and it's really helpful to understand kind of how you guys are thinking about stigma. Victoria, question for you. I know that you mentioned that you're not seeing a lot of activities around prevention. What are some of the things you're seeing more?
I mean, I think mainly I see quite a lot of programs working with, you know, group interventions, and whether that be groups of young people or whether that be groups of you know, mothers, so specific groups going through usually a sort of, for lack of a better word, a kind of curriculum or a process of, you know, you're in this group, you meet however many times over however many weeks, you start with this PHQ-9 and you end with this PHQ-9. That's the stuff that comes onto my desk. And I think that is the bias of being a foundation that is driven by impact and evidence, is that the types of organizations that make it to my desk are the ones that feel they can present a quite sort of granular impact. I don't know if that sort of answers your question and makes sense, but I think it does skew what I'm seeing versus the sort of multitude of things that are happening out there in the world. And I know from working with Anna in other ways that that's not what Anna gets, and that Anna's programs are really different because, you know, so I'm seeing this very small slice of the pie.
Right, that makes a lot of sense. Anna, do you want to jump in there with anything to add?
Yeah, I think that's really yeah, what you were saying, Victoria, really resonates with me. I think it's really complicated to explain your model often with mental health interventions, and I think then what you get is sometimes the ones that Victoria is talking about, which are, you know, incredibly valid and important, but yeah, you sometimes get that kind of because it takes time to explain what you do and to put it in a way that people get. I think we're seeing, I mean, we had an incredibly high level of submissions for EMBA that we're working through at the moment. But I can't tell you exactly what the trends are, but just anecdotally, I'm seeing a huge amount still going on with youth and young people, which is really exciting to see. And I think there's just now a big need to make sure that people, you know, those who are doing things like, say, these youth-based organizations connect. I think there's a huge amount that could then be done if there were ways for them to then connect with others and to work together. Because sometimes you're seeing quite similar models where you're thinking, oh, you know, if these guys connect with these guys, and, you know, not only would it perhaps, you know, help with around measuring impact, but it could also be less isolating, because that's something that we're seeing for those running community-based organizations. Yeah.
Thanks, Anna. Appreciate that perspective. We will close off with one final question. Oh, Sahil, did you just unmute? Do you want to jump in with something?
Yes, just one last thing. I think maybe I could flip this question and say, like, what we haven't seen so far. So we haven't seen so far in our proposals is integration. So integration, mental health interventions with other interventions, say sexual and reproductive health, or say nutrition or other things. I think so this is the space I think we haven't seen many applications, or there's not much science around it. Like, how do we integrate these interventions with other elements which are already being functional, which already has the reach? I think this is the space which is important, I think. Yeah, that's it.
That's really interesting to hear a lot about. I know that a lot of previous mental health funding was based off of more integration into other services, right? So strict mental health funding wasn't really as popular, I'm going to use that word, 5-10 years ago, right? And now it is becoming more popular. So it's interesting to hear that the lack of kind of that integration is something that you're seeing. So that's a really interesting insight. Thanks for sharing that. Okay, I'm going to call us there. Panelists, thank you so much for all of your insights today. It was a real pleasure to hear you all chat and discuss these important questions with you all. I am going to quickly share my screen. We put together a brief list of some open funding opportunities as well as some closed ones that are often recurring. Feel free to take a screenshot of it. Hopefully you guys can see this screen. It should say the mental health fundraising landscape. Hopefully you guys can see. Give me a thumbs up if someone can see that. Cool. That's great. It's not my WhatsApp. That's fantastic. So everyone go ahead and just take a screenshot of that if you'd like to. Some of these you might know of, some of them you might not have heard of. That's fine. There are so many more that are actually on this list. But we just wanted to share a handful of names with you all, some that came up today, in case you'd be interested in potentially applying or thinking about what it could look like. So with that, thank you everyone so much for coming. I'm going to hand it over to Chris to wrap us up. As a reminder, this is the first of 3 webinars we're doing. The next one will be on October 9th. We're going to dig more into that question around measurement, and we'll talk a bit more about what it means to talk about costs and impact and how you share that with your funders. And we can talk about well-bees, and if you don't know what that is, come find out. It'll be really fun. And we'll have some amazing folks who spend a lot of their time talking about cost effectiveness. And then our final one will be on November 5th, where we will talk a little bit more about a fundraising plan and how to skirt that line and figure out how to build those relationships really with funders and make sure your programs can continue to have the impact that they do. So with that, thank you all. I will hand it over to Chris, and thank you again to our panelists.
Thank you, Christy, very much indeed. As you can see, all of our friends in the audience, we are really aiming now for the next 2 webinars to take what we have done today and then make the next 2 webinars even more practical than today's has been, in the sense of going deep into what it is to actually apply for a funder and actually to hopefully realize your dreams. So that is going to be what we are going to be working on in the next webinar and the one after that. I'd asking Susan just to drop into the chat now the link to Catalyst 2030, which is the organization that we belong to. Do please feel free to join Catalyst 2030, mention my name as you do, and and be aware that this is a free offer, so there is no financial implication to joining. And then you can choose to become a member of the Mental Health Collaboration, and we will keep you obviously updated and informed. And you can also choose, of course, to be involved in many other things the Catalyst is working on. So I think that would be very important. Christy, in ending, it is for me now to thank you for being such a diligent chair and moderator of this particular session. I think you've really been able to cut down to the questions that we really need to ask, and our panelists have been wonderful in answering them. I would have felt sorry for them if they didn't feel like it. You would have certainly made them. And so basically, I think you've kicked us off to a great start. And I'm really pleased for members of the collaboration that we've got this particular session going. I see Jeffrey has his thumb up. That's a good start. Yeah. So all the best for now, and thank you so much to the panelists, and thank you, Christy, very much indeed. And mostly, thank you for coming. We've enjoyed being with you. All the best.
Thank you, everyone.
Thanks, everyone, and bye-bye.
Thank you. Bye.
Bye.
Yeah. Now.
Thank you all.
Bye.
Thank you. Thank you.
Thank you. Bye.
Bye, Florence. Take care.
Thank you. Bye.
Thanks, Samijata.
Thanks.